Details of the medical report and, of course, the political ramifications with my panel. Mercedes Schlapp, Michael Tobman, Lauren Ehrsam, and Dr. Steve Reitman. Doctor, I got to start with you. A lot of things on Hillary Clinton's list. Her medications, the lab work, also her vitals, some things that raised some red flags with folks. Initially, triglycerides are said to be extraordinarily high, but I want you to give us a general assessment of what you see here that may or may not cause you alarm.
Well, I think she released a lot of information. From a cardiologist point of view, and I run the New York Cardiac Diagnostics Center, I'm interested to see and good to see that she has a 0 calcium score, which generally signifies a low risk for heart attack, coronary artery disease.
Last time you were here, we looked at the video. You said it could have been neurological or cardiac related.
Right.
Does this kind of remove the cardiac speculation?
This makes it a little less likely. I would have liked to have seen a neurologic evaluation from a neurologist. I didn't see that in the report. I don't know if it was there. I think there was a CAT scan of the brain, which came out, which was reportedly normal. And that's helpful, but I would like to make sure there's no evidence of any mini strokes or seizure disorder by data such as an MRI or a CAT scan. But she certainly released a lot of information. She documented that she had a global pneumonia, and that was seen on the chest CAT scan.
Triglycerides at 159, is that alarming? Because they have, according to past Hillary Clinton records, have started really to skyrocket here.
Triglycerides are more of a chronic issue. It would nothing that I would be thinking about as far as an acute syncopal or fainting episode. I'd be looking more at things like cardiac arrhythmia. I would have liked to have seen a cardiologist's evaluation, maybe a 24-hour Holter monitor looking at her electrocardiogram over 24 hours. But she did release a lot of information documenting the pneumonia and other data, including radiologic data. Right. So I think it's a step in the right direction.
Mercedes, I want to ask you, because a poll taken about the candidates and have they been straightforward or straightforward with their health, have they misled the public is the key word here. 50% of the public think that Hillary Clinton has not been totally honest with them. Her doctor saying she is, quote, in excellent medical condition and, quote, fit to serve as president of the United States. Will this report, in your mind, start to mitigate some of the severe damage that she suffered over the weekend for, A, not being honest about or being straightforward about the pneumonia, and adding to already great speculation that there's something wrong with her?
Well, I think it's her one doctor, obviously, that's releasing these detailed medical reports. If you were to take what, let's say, the John McCain, where he released thousands of pages of medical information, as well as allowed journalists to interview his doctors, talk about a gold standard. I mean, that's what Senator McCain did when he ran for president. So I think it does, maybe this medical records that she released, or the statement that she released, it helps to calm the fears of the fact of that health is maybe being an issue for Hillary Clinton. However, her biggest problem has been, why did she have to block out the press, block out the public, wait several days to announce that she had pneumonia? Why the lack of transparency? I think that's why you see this poll where Americans are feeling that they have been misled by Hillary Clinton, and I think that will continue to be a problem.
Lauren, on the political side, we've got a couple of things here. A, of course, Hillary Clinton's going to have to work very, very hard to get the American public to buy into this report. And secondly, and probably a more overarching theme here, is the notion that she's just not fit, even with this particular statement, that she's not physically fit for the White House and the rigors of the White House.
Absolutely. I'm not saying that Hillary Clinton needs to follow the yellow brick road and go see Dr. Oz, but she looks pretty rough recently. She should probably seek at least a second opinion from another doctor. The American public has, for a very long time, thought that Hillary Clinton was dishonest. There's polls showing that even among Democrats, as high as 70% of them think that Hillary Clinton is dishonest. And this wouldn't be the first time that Hillary Clinton has lied about her health. She lied to her staff when she had a blood clot. She told them she had a pulled muscle, and it wasn't until her memoirs where she, I think it was maybe one line in her memoir where she talks about it was actually a blood clot. And that's how we found out the truth behind what happened. The Clintons have a history of lying. If she'll lie about her health, she'll lie about, or say she doesn't remember what was in certain emails. What else is she going to lie about?
You mentioned the yellow brick road. Donald Trump did take that road today. He taped an interview with Dr. Oz where he did talk about his health, and he turned over results from a recent physical to the award-winning TV doctor. I want to take a listen to this.
Health is as strong as it seems from your review of systems. Why not share your medical records? Why not?
Well, I have really no problem in doing it. I have it right here. I mean, should I do it? I don't care. Should I do it? It's two letters. One is the report, and the other is from Lenox Hill Hospital.
May I see them?
Saying, yeah, sure.
So these are the report. This is from.
Those were all the tests that were just done last week.
Now, several members of the audience who were present for the taping tell Fox News that Donald Trump said he wants to lose 15 to 20 pounds and that he takes medication for his cholesterol. Doc, let me go back to you. Apparently, there was a full review of the systems. I want you to explain to the audience what that means. It included the nervous system, head, neck, hormone, cardiovascular, respiratory, and a few other areas, including history of cancer. This is relatively vague. Obviously, we'll have some details, but it was a one-pager. Do you think that's enough? Because most of the viewers who've been polled who saw that felt that Dr. Oz gave him the check off for being in great health.
All review of systems is that when you take a history, you go over and you speak to the patient. You know, how's your heart, how's your neurologic. It's not real hard objective data. What you want to see, if you want to have a fair and equal comparison, is to see stress testing like we do in our office, stress tests, make sure there's not a risk of heart attack, risk of stroke, and a full set of battery of blood tests and radiologic
Mercedes
testing.
talked about the gold standard. Do we need to go that far? Should it be full open kimono in your mind? Again, with respects to the rigors rather of the office of the presidency.
That's something that's more of a political than a medical question. I think if you really...
No, but from a doctor's point of view, understanding the stress. We see photos before and after, okay? It's obviously a stressful job. I mean, both of these candidates they're 68 and 70. From a medical perspective and what the American public feels they deserve, would you want to see more from both candidates?
Yeah, absolutely. I'd love to see a full evaluation, including not only history and physical, but blood testing, stress testing, radiologic testing, and looking at all the risks for problems that can occur in this age group of 65 to 70 years old.
Michael, a whole lot of pressure on your candidate. A lot of this she brought on herself. I know we can't go back, but imagine if she said Saturday morning, hey, guys, I've got pneumonia. It's not contagious, but I'm going to head down into the 9/11 thing for half an hour to show respect and then go home. But she didn't. So now here we are wondering if this is going to be enough because her fortunes have taken a dive recently.
It speaks to a lot of issues for both of the candidates, and we're seeing them both play true to form, which is Hillary, as was said on one of your colleagues' shows, it's not about the health, it's about the stealth. Wouldn't take advice from people. She made up her mind and then wouldn't hear anything about it. And Trump giving the appearance of transparency in a reality show style way. But ultimately, yes, to answer your question directly, there were 100 different ways to handle this. All of them would have been better than what happened, and it was sort of a worst-case scenario.
Right. Mercedes, of course, we saw political jiu-jitsu on this one from the Democratic side saying, hey, while we're on the topic of open kimono on health, let's bring taxes out as well. So we kind of know what the counter is going to be tomorrow. I think it's brilliant to go on Dr. Oz, but do you think that will be enough to sway anyone from saying Donald Trump's still not revealing enough of himself?
Right. I mean, I think it's fair game for the Democrats to go forward and say, okay, Mr. Trump, you need to reveal more of your medical records. And that's the biggest challenge, right? And I think for the American people, they have a right to know that their candidates are fit to be president. As you mentioned, and I worked in the White House, it is grueling hours day in and day out. Now, I can tell you, the video that you saw of Hillary Clinton was incredibly disturbing, and they tried to keep that in the dark if it wasn't for that bystander that caught her on video. For Donald Trump, the mere fact that he's able to have multiple rallies every day, I mean, his stamina, it really shows a contrast between those two candidates and their energy. Yeah,
there's absolutely no doubt about it. He does more events. He's always on the run. He's always he's moving really good. And a lot of people hope they can move as well as he does at age 70. Thank you all very much. Appreciate it. Coming up, former Secretary of State